for it. So how about taking 3 minutes, grab yourself some coffee, and then we'll begin. It's in the back room there. I'm so delighted that so many of you chose to be here this morning. I'd like to welcome you to the 21st Family Impact Seminar. We've been doing these seminars for state policymakers since year 2000, and this is a nice crowd, so thank you for coming. I'm a faculty member in the Department of Human Development and Family Studies. My name is Esther Onaga, and we believe in the department that families are a basic building block of society. Families are a cornerstone for raising productive workers in a sound economy and responsible citizens in a strong democracy. I had to put a plug in for our belief system. But even strong families struggle, and they are stressed by the inability to find a job, afford health insurance, secure quality child care, and sending their children to good schools. The Family Impact Seminars are a series of presentations providing briefing reports, which are in your folders. And this information is delivered in a timely manner. Unlike many of the seminars, the advisory group picks the topic. I'm not an expert on healthcare, but we can scramble and find the best source of information and the speakers who can present it in an engaging fashion for you. We believe in the value of objective research and delivering the information to people who can really create policies that can make the lives of families better. Today we have seminars sponsored in 22 states, so Michigan is not the only state. All are university or extension based. We have covered healthcare issues, economic development, juvenile and adult crime, childhood care and education, welfare reform, and family violence. This year, the Family Impact Seminars was recognized as a bright idea by the Harvard Innovations in Government program. These seminars are possible with the support of many people and organizations. We are fortunate to have the co-sponsorship from the House and Senate Health Policy Committees, and we have Representative Gail Haynes someplace. Senator Martel would be joining us, and he chairs the Senate committee. We have had tremendous assistance from the Michigan Health Council to identify examples of the team care approach in Michigan. Drew and Don, people from the Healthcare Council, raise your hands. Okay, thank you very much. We also have received continuous support from the Michigan Department of Community Health. Melanie Brim helped us last seminar, and she's back again to help us. So I keep asking. We also had a very generous funder in the name of Kellogg Foundation, and we're grateful for that. In turn for the foundation's support, I will need to be accountable to them, and so we have green evaluation sheets. And I know that it's easy to ignore them, but they will help me write a good report to them. And so if you could help us in filling out the sheet, I really would appreciate that. And you'll get pie. That sounds Skinnerian, I know. Now I'd like to turn the floor over to Representative Haynes, who will introduce our speaker, Dr. Sevcik.
Thank you very much, Esther. It is certainly delightful for me to be here with what I have come to feel is my MSU family. The Michigan Family Impact Seminars have always been very informational, and I really do appreciate MSU and all the work that they've done to provide these types of seminars for us. I would also like to take just a minute to introduce my vice chair in health policy, and that's Representative Mike Colton. I now would like to introduce our first speaker, Dr. Donald Sevcik. Dr. Sevcik is the Senior Associate Dean at Michigan State University's College of Osteopathic Medicine. His educational background includes Doctor of Osteopathic Medicine, MS in Pharmacology, and an MBA. Through his professional career, he has provided care to patients as a pharmacist, general practitioner, and emergency medicine physician, often in a team-based environment. As an educator and preceptor, he has trained medical students, physician's assistants, nurses, nurse practitioners, physical therapists, and pharmacists. And now today, he is here to educate us. So please join me in welcoming Dr. Donald Sevcik.
Thanks, Drew, for fixing that. Well, good morning to everybody. I'll start with, I'm a huge introvert. So if I start talking really fast, you'll understand that I'm compensating for that need to pretend like I'm an extrovert for a few minutes. Mr. Paradise will attest to the fact that he just turned around and shake my hand and it's cold and clammy and sweaty. And my wife goes, I've been married 33 years, she goes, why do you do this if it makes you so nervous? And I do it because I enjoy it and I'm very passionate about certain things. One of them is this topic in professional education specifically. So I'd like to thank Drew and Donald and Craig and David and Ann and everybody else who put the slides together because they made my job real easy. And they said, you can talk about whatever you want. So because there was a recent program where there was a power outage, I brought a few notes that match my slides just in case the slides go down. But I'm hopeful that I don't have to use them. So let me begin with this. The Institute of Medicine published a report in 1972 that talked about building health teams. And it's taken us about 40 years, if you do the math, to really get to the point where that initiative is finally getting some traction. In the 1970s, I was in pharmacy school, and when that report first came out, I can't say that I read it, but there was a lot of discussion about the things that health teams could and should do to improve patient care, safety, outcomes, a number of things. So I start with that because the good news was I looked in the evaluation forms, and you're not evaluating the speakers today because I would have been number 7 of 7, I know that. So it's good that I don't have to worry about that, but I looked at the things, that the before and after questions, and I'd like to believe that we will touch on all of them. In fact, I'm going to tee up a lot of that content and then get out of the way. So, where are the students from Michigan State? Okay, so, I look, I make eye contact, and I want you to keep nodding like you're agreeing and I'm doing a good job just to help me out, okay? So, first and foremost, you take a look at that picture, and the title is Transformations in Healthcare, and what does that really mean? I mean, what is the message, and why did we start with this picture? Now, I'm a huge believer as an educator that if you walk out of any session, you've learned 5 things you'll remember for the rest of your life. It was a good day. And you have to stop and think about things. So, to the students, I can stand up here till my time is up, and we're not going to go past the slide if we don't give you something. So what does that picture say to you? When was the picture taken, do you think?
How long do you think it was?
Somewhere around the turn of the century, around the 1900s. All right, if you take a look, what was the average life expectancy around the turn of the century?
45.
It was about 49, 48, 49 years old. That's exactly right. And what's the average life expectancy currently estimated to be about? At the time of birth, most people live to be about 78, 79. By 2050, what will the estimated life expectancy be? about 81. All right, so in the first half of the 1900s, we made tremendous advances with germ therapy, theory, a whole bunch of different sorts of things. We're not going to make big advances. So what's really happened is we've made tremendous strides which have really impacted how healthcare is delivered. Now, the interesting thing about this, and I wasn't there then, but in this era, in the 1900s, how many physicians were actually graduates of medical schools? 10%. 10% of practicing physicians around 1900 were actually graduates of medical schools, most of them trained in an apprentice model. There were pharmacists and there were nurses, but essentially there was nobody else. Okay, that's about where we stood at that point in time. So we fast forward, if I can find my little thing here and make it work, we fast forward to these new and evolving models of team-based care. So in '72, the Institute of Medicine I already mentioned came out and said there's some things we need to start to do. So back to my students, because I will continue to go to, because I'm not going to ask any questions of the state legislators or their aides, okay? But I totally have free reign with the students from Michigan State. What's different about this picture? It's recent. You take a look to your left, and we see some patients who are well past 65 would all agree to that, right? Then we kind of take a look in the middle of the picture, and we see a young lady with what we're assuming is her son. And we see somebody off to the right who is probably the father of the young lady who is the offspring of the folks to the left. We've got 4 generations of folks here. So one of the things that's become important to us as we deliver healthcare is we need to look at multiple generations of expectations, comorbidity. People past 65 on average, about 50% of them have at least 3 different chronic diseases. And that's changed the complexity of how we need to deliver care. Does that make sense to everybody? Okay, we got women's care, we got all these sorts of things, we got pediatric care, we got geriatrics care. Back in about 1930, there were 2 groups of physicians. There were general practitioners who were about 80% of everybody, and there were about 20% of the physicians who were specialists, and almost all of them were surgeons. Any idea how many specialties and subspecialties we currently have in medicine today? Over 140. 140, so we've really got to the point where we started to separate and segregate and compartmentalize a lot of things. Now, in 1965, the first nurse practitioners program opened at the University of Colorado. In 1967, the first physician assistant program opened at Duke with 3 students. Okay. Currently in the United States, it's estimated there's about 155,000 nurse practitioners, and there's about 93,000 physician assistants. In the state of Michigan, there are about 4,000 nurse practitioners, and there are about 3,100 physician assistants. So we start to look at this mix, this milieu, and it's clear that we have to practice in a team-based manner. So what does this mean for the state of Michigan, and how do we get there? I put this up as a transitional slide because I'll get to the demographics and a few things here in just a minute. And I'm always worried that I'll end a little bit early because as an ER doc, I like to get to the point. Melanie Brim told me she stands ready whenever I'm done to jump in, so we'll have a nice transition whenever that hits, all right? What does this slide say to you? Genetics, lifestyle, behavior, and the environment. Of all the diseases, of all the morbidity we currently experience, of all the things we treat as healthcare providers, what percentage of all of our maladies are caused by those 3 things? 90%. 20% are genetics, 50% are lifestyle and behavioral choices, and another 20% are the environment. So when we start to look at the places we live, and you walk into a store that provides services such as we see there, it's not unexpected that we are a bit challenged as a society by certain diseases like obesity, like diabetes, like heart disease. In the state of Michigan, 1 in 3 people who live in the state of Michigan fits the definition and characteristics of being obese. 1 in 10 patients in the state of Michigan has diabetes, and of the patients more than 65 years old, 1 in 5 have diabetes. Obesity, diabetes are huge risk factors for heart disease. So I won't even give you the numbers there. There's a lot of stuff in your briefing. I don't like to throw a lot of numbers at you, but I feel like as an educator, I got to give you a few. So there's a lot of moving parts here. West Michigan, when we get out of the way, will talk to you about their programs that have to do with obesity and the interprofessional initiatives on the west side of the state. Ferris State has some programs where they're talking about diabetes and the examination that's required of diabetic patients. to better help them understand the maladies that are there. And all of these things are happening as teams. So we're moving in that general direction. Now, what does it mean for the state of Michigan? Well, when we look at healthcare, it has an expense. It's complicated. There's a lot of things that go on, and we have a lot of things that we need to worry about. So, when we look at the state of Michigan and all of these things, I'm colorblind, so thanks guys for giving me this slide. So I'm going to go off of what you told me, okay? All of the little symbols represent different types of healthcare facilities. The purple areas are a geographic distribution of health professional shortage areas, and the green areas are by population that also define health professional shortage areas. The bottom line take-home message, and even for somebody like me who's colorblind, is I can see that we have a maldistribution of healthcare access throughout the entire state of Michigan. Okay, barring a few small geographic areas, this is widespread and involves the entire state. So what do we do about it? How can we get there? Team-based healthcare. So finally, I've set it up for you. This has been a 110-year journey. We've got there quickly. There's a lot of things happening. Some things are going to change. But with the complexity of where we are, it's clear that we need to have better outcomes coordinated through patient care. Of all the patient safety issues, of all the errors that happen, how many are dependent on communication that didn't happen between different healthcare providers? Any idea how many sentinel events are driven by a dropped communication issue? Between 70 and 80% of all healthcare safety issues are believed to be the sentinel event that involves some communication issue. Well, if we can get better about programming people and training them and getting them to think and be comfortable with one another as healthcare providers, communication should be less of an issue. I was at a hospital on the east side of the state, I won't mention the name of it, on Thursday last week. And there are some areas, and they're not just limited to geographic locations of the state, they're not limited to the Midwest, they're national issues where this is going to be a challenge for us. And I look forward to what's going to happen, and I'm just sad that my career probably won't last long enough to see how this ends. And I don't mean how it ends in the long term, I mean even in the shorter term, because it took us 40 years to get to the point where we're talking about it at the state capitol. I hope it doesn't take us 40 years to get to the point where we really understand this. Because as of 2008, the last time a big Cochrane review was done, do you know how many randomized controlled studies that we're looking at in interprofessional healthcare? 6. So we don't know a lot yet about the delivery side. We're working a lot on the educational side so that we can train the healthcare providers of tomorrow to be better positioned to understand what they can each deliver. So when we look at the definition, I was told I have a wide group, so I'll start with the definition for those who aren't familiar with interprofessional education or healthcare. It is when two or more healthcare disciplines work together to learn from, learn about, and learn with each other